Hello, my friend. Did you know that the secret to improving the support for your erection after age 60 might not lie in strength, but in your ability to relax? It sounds counterintuitive, doesn't it? Most men believe they need to contract everything with great force, but today I'm going to show you a detail that almost no one talks about. The quality of your relaxation and its synchronization with your breathing can be much more important than the number of repetitions. Stay with me, because we are going to explore how some body awareness exercises, when done correctly, can indeed help optimize the musculature that supports your erectile function. I am Dr. Evelyn Reed. I am a medical doctor from Johns Hopkins University with a residency and doctorate in urology from the same institution. I completed a fellowship in sexual medicine in Germany and dedicated years of my research to understanding pelvic microcirculation and male vascular health. For over 20 years, I have been running my clinic in New York, where I help men, especially those over 60, take care of their sexual health based on science and in a very practical way, always without false promises or miracle shortcuts. My goal here is to give you safe guidance so you can make the best decisions for your well-being. Let's get straight to the point that few people address. When we talk about pelvic floor exercises, the image that comes to mind is of effort, of contracting vigorously. But the real secret, the missing piece for many men, lies in the opposite, in the quality of relaxation and how you synchronize it with slow nasal breathing. Many men, in an attempt to do the exercise, end up tensing their belly, buttocks, or thighs. This diffuse effort is not only ineffective but can even hinder blood flow to the region. The focus should be on isolating, feeling, and most importantly, completely relaxing the pelvic muscles. It's this ability to control both contraction and relaxation that tends to improve mastery over the blood flow that enters and, crucially, remains in the penis. An erection is in essence a hydraulic event, and the surrounding musculature acts as a kind of clamp or valve. If this valve is tense all the time, it doesn't work well. If it lacks tone, it also fails. Balance is the key. To understand why this can work, let's think about the mechanics of an erection in a very simple way. For it to happen and stay firm, more blood needs to enter the penis than leave it. It's a balance of flow. The pelvic floor muscles, specifically muscles like the ischiocavernosus and bulbospongiosus, surround the base of the penis. When these muscles are activated correctly, they can help gently compress the veins that drain blood out of the corpora cavernosa. Think of them as a mechanical aid to keep the blood trapped in the right place, promoting rigidity. Therefore, having adequate muscle tone with the ability to both contract consciously and, this is fundamental, to relax completely tends to offer structural support for the erection. In some men, this improvement in muscle control can also contribute to better command over the ejaculatory moment, increasing confidence and pleasure. We are not talking about a miracle cure, but about optimizing the physiology your body already has. Now let's turn this theory into practice with an action plan, a true stacking of habits that you can start today, safely and gradually. The first layer, the foundation of everything, is breathing and pelvic awareness. What is this? Simply lie on your back with your knees bent and your feet flat on the bed or floor. Close your eyes and breathe slowly, only through your nose. As you exhale, without any effort, just try to notice, to identify the subtle sensation of pulling in and up the muscles located between your anus and the base of your scrotum. Do not contract your buttocks. Do not tighten your abdomen. The sensation is minimal, almost a thought. Why can this help? Because this is the first and most crucial step of all, establishing the connection between your mind and this specific muscle. Without this awareness, any exercise will be a shot in the dark. How can you start today? Right now, wherever you are. Do 5 cycles of slow breathing, inhaling through your nose and exhaling slowly, and with each exhalation, just bring your attention to this region, trying to feel this subtle movement. The general caution here is not to force it. If you don't feel anything at first, that's okay. The intention alone begins to build this neural pathway. Once you feel more familiar with the area, we can add the second layer, controlled contraction and relaxation. In the same lying position, you will continue with slow nasal breathing. As you exhale, gently contract that same muscle for about 3 seconds. The contraction should be firm but controlled without engaging other muscles. And here comes the most important part. As you inhale, completely relax this muscle for 5 to 6 seconds. The relaxation time should be longer than the contraction time. Why can this help? Because it is this movement of contracting and relaxing that effectively strengthens and tones the ischiocavernosus and bulbospongiosus muscles, which, as we've seen, actively participate in supporting the erection. How to start today? Do a single set of 5 to 8 of these controlled contractions, prioritizing the feeling of total relaxation between each one. Quality is infinitely more important than quantity. The caution here is for men who suffer from chronic pelvic pain. In this case, it is essential to talk to your doctor before starting, as improper contraction can worsen the condition. Finally, the third layer is functional integration. After a few days of practicing the first 2 steps, we can start training this muscle to be activated in more functional positions, not just in isolation while lying down. A great exercise for this is the bridge, that hip lift. Lying in the same position with your knees bent, you will slowly raise your hips. The moment your hips are at their highest point, you perform the pelvic contraction, hold for a moment, and then completely relax the pelvic muscles as you slowly and controlledly lower your hips back to the starting position. Why does this help? Because it teaches your brain and your muscles to work together in a more complex movement, which has more carryover to daily activities and to sexual intercourse itself. How to start today? Try to do 5 slow bridges, perfectly synchronizing the contraction with the peak of the movement and the relaxation with the descent. The fundamental caution here is to keep breathing flowing the entire time. Never, under any circumstances, hold your breath during the effort. This increases intra-abdominal pressure and goes against the entire principle of the exercise. It's important to reinforce that, although the title mentions enhancing your erection, these exercises are a physiological tool to optimize the supportive muscle function. They do not cure diseases nor replace essential medical treatments for conditions like uncontrolled diabetes, hypertension, hormonal problems, or heart disease, which are often the primary causes of erectile dysfunction. Think of these exercises like physical therapy. They strengthen a specific part of the body so that it can perform its natural function better. Many men try and give up because they make some mistakes that completely sabotage the process. The first and most common is using force from the abdomen, thighs, or buttocks, as I've already mentioned. This diverts the focus from the correct muscle. The second mistake is holding the breath during the contraction, which creates unnecessary tension. The third is focusing only on contracting and forgetting to relax completely, which can lead to a tense and fatigued muscle, worsening the situation. Doing many fast, uncontrolled repetitions is also a mistake. Quality and slowness are paramount here. And, perhaps the biggest saboteur of all, is giving up after a week for not seeing drastic results. This is training. It takes time and consistency to build the mind-muscle connection and for muscle tone to improve. I know some questions may arise. A common objection is, "Doctor, I don't know if I'm doing it right. I don't feel anything." A practical tip to identify the correct muscle is, the next time you urinate, try to stop the flow of urine for a second or 2. The muscle you use to do this is exactly the pelvic floor muscle. Please note, do not make this a regular exercise. Do not keep stopping and starting the urine stream, as this can, in the long run, affect your bladder. Use this technique only once or twice to learn how to locate the correct musculature. Another objection is lack of time. But the beauty of these exercises is that they require no equipment and no special place. 5 minutes a day, lying in your own bed before sleep or right after waking up, can, over time, bring benefits. Daily consistency for a few minutes is much more effective than doing 30 minutes once a week. And for those who already use medications like tadalafil or sildenafil, the question is whether this still helps. The answer is yes, very much so. They work on different fronts and can complement each other. The medication acts on the chemical part, facilitating the action of nitric oxide to dilate the vessels and allow blood to enter. The exercises act on the mechanical muscular part, which helps to keep that blood in place. It's like ensuring that both the faucet and the plumbing are working well. Throughout my years of practice, I have seen many men benefit from this approach. I remember a patient, Mr. Charles, a 71-year-old retired professor from Denver, who was very frustrated. He started practicing this routine of awareness and controlled contraction consistently every night. In about a month, he reported not a miraculous change, but a feeling of greater control, of more firmness at the base, and he noticed a significant improvement in the quality and frequency of his morning erections. Another case that stood out to me was Mr. Robert, a 68-year-old engineer from Seattle, whose main complaint was that his erections wouldn't last. They would lose rigidity quickly. With pelvic training focused on both relaxation and contraction, he began to feel more confident in his ability to maintain rigidity during intercourse, which reduced his performance anxiety and improved his sex life as a whole. From a scientific standpoint, what I'm sharing with you is not some alternative novelty. There is robust scientific evidence supporting pelvic floor muscle training as a treatment option for erectile dysfunction and, in some cases, for premature ejaculation. International urology and sexual medicine guidelines often recommend this approach as a first or second-line therapy, especially in specific cases such as after prostate surgery. However, it is crucial to understand that results vary greatly from person to person and depend directly on the underlying cause of the dysfunction. If the cause is purely vascular or neurological, the exercises can play a supportive role. If there is a significant muscular component, they can be protagonists. Therefore, this content is educational, and an individual evaluation with a doctor who understands the subject is always indispensable for a correct diagnosis and a complete treatment plan. Finally, and most importantly, let's talk about safety. Before starting any new exercise routine, talk to your doctor, especially if you have a history of prostate surgery, chronic pelvic pain, an inguinal hernia, or heart conditions that limit physical exertion. If you feel any sharp pain, stabbing sensation, or unusual discomfort during the exercises, stop immediately. And please see a urologist or go to an emergency room if your erectile dysfunction is of sudden and complete onset, if it is accompanied by chest pain, shortness of breath, or fainting, or if you notice blood in your urine or semen. These could be signs of more serious conditions that need immediate attention. Did this guidance make sense to you? I would really like to know. Comment below with the number 1 if the information was useful, or 0 if it wasn't what you expected. Also, tell me which city and state you're watching from. I love to see the reach this conversation about men's health can have. And if you believe this video can help a friend, a brother, or an acquaintance over 60, please share it. Sometimes quality and trustworthy information is the first step toward a great change. Take good care of yourself, and remember, the journey to full sexual health and maturity is built with knowledge, consistency, and kindness to yourself.